The information shared on the Sky Women's Health podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding your medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Reliance on any information provided by Sky Women's Health, Dr. Carolyn Moyers, or any guests featured on the podcast is solely at your own risk. You're listening to Sky Women's Health Podcast, your evidence-based resource for women's health and wellness, exploring the holistic principles of osteopathy, integrating mind, body, and spirit, designed to empower you as your own healthcare advocate and help you live your best life. I'm your host, board-certified OBGYN, Dr. Carolyn Moyers. Welcome to Sky Women's Health Podcast. Welcome back, Sky Women. Today, I have one of our most common referrals is to cognitive behavioral therapy. And so I thought, who better to have on but some of our favorite cognitive behavioral therapists from Vervewell. We're talking today about that midlife mood, the biology, stressors, and treatment of that perimenopause, menopause, depression, and how cognitive behavioral therapy can help us with all of those life stresses. I have with us Beth Lewis, the founder of Vervewell, and Heather Chandler, one of my favorite counselors I send over to. Thank you so much for joining us. And also, if you are coming to our World Menopause event on World Menopause Day, the 18th of this month, it's a Saturday morning from 10 to 12, you'll be able to meet some of the Vervewell people there as well. Welcome, ladies.
Thank you. Thanks for having us.
It's a pleasure. Well, so often people going to therapy or just addressing their mental health can be a real challenge. There's some barriers around, social expectations or them feeling like maybe they failed or maybe it's not that bad. I don't need that. I think therapy is for everyone.
Agreed. Agreed.
And I think, isn't that Joe's catchphrase?
Yeah, therapy for everyone. It is our catchphrase, as well as I believe it, I put it in the frame of self-care. I think that it's something good to do for yourself, as opposed to, like you mentioned, a handful of things like, oh, I'm failing, or there's a big problem, something's wrong. And I like to lean into, instead of ever saying that there's a diagnostic situation or a disorder, I like to lean in that we are humans and we are existing within the human condition. And the human condition has ups and downs and ins and outs. And all of us will experience from time to time anxiety or depression or weird little things flying through our head or obsessive thoughts, or that all of us are. Anyone with a pulse will experience these things from time to time. And so to surround or to connect yourself with a relationship with a therapist and to have that ongoing relationship, we also encourage our clients to stay in, just keep coming in, have a long-term relationship with your therapist, because it develops this really cool relationship where you can come in on those darker days and you've just saw your therapist for the last several weeks or several months, and you can have this tough conversation without having to build the chemistry or to build the relationship. It's just there for you to utilize and to care for yourself in the darker moments, in the celebratory moments, whatever you might be going through as a human living the human condition.
Right. There are so many ups and downs in life, and the unmanaged mind will run amok, right?
The unmanaged mind will run amok. You are correct. I like that.
Yes. And perimenopause, when we start seeing these fluctuations in our hormones, it affects more than our periods. It changes your brain, your sleep, your relationships, sometimes your mood. And we need to unpack why, right? If we have a history of postpartum depression, if we have a history of depression in general, in midlife, when we start seeing these hormonal fluctuations, and then when in postmenopause, when our estrogen just drops off the planet, we have significant effect on our brain and our mood that affects everything. And what I love about your group is that y'all are looking at not only midlife women, but mindfulness, focusing on cognitive behavioral therapy, couples therapy, caregiver stress, all of these different aspects of life that we're addressing in midlife, right? Where we're caring for children and we've got aging parents and then we've got the relationship, we might be at the height of our career. There is so much going on.
Yeah. Yeah. Absolutely. Absolutely. And I have when we work with couples, the conversation often with menopausal menopause is in the conversation. I happen to work with those that have experienced some sexual trauma. And sexual trauma shows up in our sex lives, of course. And having that, and yet then it double downs when you're in going through menopause and you have some sexual trauma in there and your sex drive just goes kaput. And having the conversations, very bold conversations. I'm always so proud of my clients, my couples who can really just go there and talk about dirty shit. Like we can talk about some dirty stuff. We can talk about some graphic information when it comes to their sex lives, and being able to really dissect it and be vulnerable and express what they're going through. And sometimes it's physical pain. Sometimes it is biological. Often in my case with my clients, it is a past or a history of sexual trauma. And then we're finally at an age or a space. And I've said to clients before, how lucky you are, husband or wife. Your wife is now coming to you and feels safe enough to really disclose all of this, or this little bit or lot of sexual trauma. You're her safe space. You have allowed
Right,
that in
right.
your relationship. That's cool as hell. That's beautiful. And while it has gotten in the way of your sex life, it's such a connector if you allow it to be, because you have created this space where this precious human has finally been able to say, here's some of my story. And those are important conversations that we have in my therapy room.
Yeah, I think it's so important to address that and having a safe place. I always encourage patients that if one therapist doesn't work for you, it doesn't mean that therapy is not for you. We just have to
Absolutely.
find the right therapist for you. And so knowing that you have trauma informed therapy is very key
Yeah.
because so often this is a part of a woman's story.
Yep.
Yeah. Yeah.
Absolutely.
Yeah.
Absolutely. And it takes that the ability. I encourage often, for it's not for everybody, and I certainly don't push it if it's not for a client. However, I do encourage, when I'm seeing an individual, I'll ask about their spouse. Will your spouse be willing to come in and share these conversations, these bold conversations you're having with me? Are you ready for that? Are you ready to have, because if we can bring him or her in, your spouse into these conversations, that's a connecting moment. And it's something for your, again, not for everybody. Some things don't need to be disclosed. Some things need to be kept in a therapy room and only given to the therapist. And that's absolutely supported and allowed. If there is a supportive spouse at home, I love it when they can come in together and share that conversation.
Yeah, I love that you bring that up because so often women need to have a space for themselves first.
Yeah,
And then when they're ready, they
absolutely.
invite the partner in
Mm-hmm.
to have partner therapy.
Yep.
Yeah.
Yep.
Well,
Yep.
Dr. Maurice, I'm curious. One of the things that you talked about a minute ago was this idea of like we kind of, depending on age and stage of life, and how early did we have children? How early did we marry? How old are our parents? What I am experiencing a lot of with clients is um, it's like this twisted web that happens about this age between early to mid 40s, early to mid 50s, where maybe women have waited longer to have children and they've got school age kids, preteen, teenagers, and then hello, here's perimenopause, menopause. Oh, and by the way, here's your crazy ass mom who's 60 or 70 years old and has now decided she can't take care of herself. And so you're juggling and you're like, you got to be kidding me right now, right? And I just can tell you personally, like my mom will listen to this podcast and I'll be in huge trouble, but uh I will tell you, like, I don't have teenagers. I did have children younger, and my boys are grown. But I very often see this. Like, we've recreated this sandwich generation, and I think that with the women, a lot of the women that you're seeing for these issues are experiencing that. So I think one of my goals as a therapist, when you refer clients to me, or I get clients and I have sessions with them, and I say, "Wow, okay." I don't have a magic wand, but I got some magic for you if you'll go see Dr. Moyers. I promise I know what's happening here. That idea of I just remember the power of when I came to you and I was like, someone finally listened, right? And I like to really be that person for my clients to be like, oh my gosh, someone finally understands me, right? And it doesn't matter if
Yes.
it really doesn't matter what age they are. It doesn't matter if they're in their 30s and they're juggling this, their 40s, their 50s, 60s. It's just that being seen, being heard, understanding there is no normal, but what you're experiencing is normal. I think that in and of itself is one of the most powerful things about therapy, is to just understand that we're not alone and we have a space where we can talk about some of these crazy things that are going on in our head, that we're like, seriously, nobody needs to know this besides my therapist. You're probably not wrong.
Right, right. And you don't have to share it with, your sister who's invested or the
Right.
neighbor or, like
That's right.
you have somebody who's totally unbiased and can kind of give you some insight. And sometimes just processing that really helps. But to your point, the psychological stressors very commonly interact with that menopausal transition and worsens the mood, whether it's caregiving, relationship strain, career plateau, empty nest, financial worry, grief, identity shifts. All of that really plays into how we show up as human.
Mhm. Mhm. Absolutely. And I appreciate well, one, I love it when you send your patients, because I know that they are like-minded, like the three of us, when they're very invested in their well-being. They're very invested in being a more a stronger three-dimensional version of themselves than they have been for the last however long. And so I know that they're very interested in learning about themselves and learning what's going on in their home. What are all these stressors? And what I've also run into from time to time, and this might be getting us off topic, and I certainly don't want to. I know that Texas women, Verve Well Counseling is based in Texas, in Fort Worth, Texas specifically. And Texas women, especially in my age bracket, I'm in my 50s, are just riddled with the need to apologize for
Oh, can we please stop
almost
apologizing?
everything. I have said to any client who will listen, I'm like, no apologies. We're not apologizing unless you have truly caused somebody harm. I want you to not use the tiny two-word phrase, I'm sorry, unless it is absolutely, to me, I'm sorry means it won't happen again. So when you walk into a room and bump something, oh, I'm sorry. It's Texas women like to apologize. Southern women like to apologize for their existence. I swear.
And
And it's,
I have to tell you something about this. So one of my good friends is a dermatologist, and she was in Manhattan, and she tells this story that women come in and they're sweaty or they didn't shave, and it's constantly apologizing for their bodies, right? She said men come in the same condition and don't ever speak a word.
nope,
It's like,
nope,
I am who I am, right?
that's
We
right.
take up space and we have the right to take up space.
Yep.
And so I think that it's something that's so common to the the female gender. And I think that it's something that we have to undo. A lot of times, even when you're like writing an email, right, you may say, I'm sorry that da 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 da. No, just remove the I'm sorry. It is what it is. We do not need to apologize.
Right, right. And I've always been taught, or I've learned throughout the years, instead of saying, I'm sorry I'm late, always say, thank you for waiting. Instead, just reframing it from I'm sorry to thank you, or whatever it is. But with that, I'm going to tally that onto sex lives and that come into our sessions. Women more than men really take the full responsibility for a sex life being. It's interesting because they'll take full responsibility if their sex life is lacking, but they won't take full responsibility if their sex life is on point. It's just this posture women have been taught to take up or to have. And I work diligently with my clients to reword the internal dialogue and the external dialogue as much as I can. Just ownership is wise. We need to take ownership, of course, but to shoulder all the bad and to try to fix it and make it right and to people please is a stereotypical Southern female thing.
It is. And women also tend to take on the burden of, if their sex drive is lower than or greater than their spouse, something must be wrong with them.
Yes.
So this is something that is so very common. And a lot of times it is just looking at the information. I love to refer patients to Rosie, which is a phenomenal female sexual health app developed by an OBGYN and has chocked full of amazing information and resources. There's even like paid levels in there where you can actually get into sex therapy and coaching. Also, You Are Not Broken is a fabulous book by Dr. Kelly Casperson that I love to instruct couples to read. I had a patient recently who came in, similar story, distressed, perimenopausal phase, sex life isn't great, her drive is just gone. Also hot flashes and night sweats and dry vagina, right? So we take care of that, and she's sleeping through the night, and she's not having hot flashes and night sweats anymore. She's on her vaginal estrogen, and she now can have pain-free sex. She read You Are Not Broken, and she's like, oh my God, I just needed that reframe to my brain.
I love that. I've made a note of that book. I'm going to be reading that for sure. Very, very interesting. Very interesting.
So I want to ask you guys a couple of questions specific to cognitive behavioral therapy. What psychotherapeutic approaches really show the best results in this menopause, depression, anxiety, overwhelm, agitation, moodiness that we tend to see?
So I'm actually going to ping pong off of kind of something that we had talked about previously, Dr. Moyers, the idea of multidisciplinary, right? Because I think that it's similar in therapy. We all come to the table, and mostly I kind of think it's what your personality kind of connects to as a therapist as you're going through your schooling and your internships and your associate work. It's what connects with you, like what makes sense. Because how am I going to teach somebody something that doesn't make any sense to me? It has to really make sense to me for me to be able to help apply it with clients. So looking at it from the multidisciplinary perspective is so important, because not every thing that a client is struggling with or seeing as a challenge is appropriate for cognitive behavioral therapy. Some things are much more goal oriented, and so we'll use more of like solution focused, right? There are times where I'm not a huge fan of it, but I will even pull a little bit of parts work in, and like talking about like the inner child and like where did you learn that, and and then but predominantly cognitive behavioral. What I feel is so powerful about that is you can work both directions, right? We can look at our thoughts, create our emotional reactions. Therefore, the combination of those two things affects our behavior, what we will and won't do, right? Who we'll interact with, who we won't. So we can go that direction with it. But we can also look at the behavior side. I always do this. I always make this choice. I always choose this kind of partner. And we can go the opposite direction. We can say, okay, well then what is that doing for you? What's the emotion what's created by that behavior? And where do those who told you that's the way you were supposed to do it? How did you come up with the idea that that was correct? So to me, that's the power of CBT, is the ability to really meet the client where they are and handle it very individually. I call it, I was in education for 20 years, so I call it the therapeutic IEP, because I literally can take each individual person, each individual goal, and I can say, all right, where do we start with this? And I just think that's really powerful to have a whole bag of tools within one type of tool. I think that's super powerful.
I agree. And I think that and it was so well said. And I think that what our part of our job in the first handful of sessions, it's not just the first session, it takes a handful of sessions to have conversations with our clients to really learn what approach is going to resonate with this client. What approach is going to resonate? When I talk about meditation, it's going to go over, not over the head of, but it's going to get lost on some of my clients because they're just not going to be interested in that approach. But they might be interested in something a lot more like childhood based and where these things come from. And so I can kind of read the room, if you will, and figure out what is going to resonate, because our goal is to be supportive. Our goal is to learn our client, hear our client, and offer them new paths, offer them ways of thinking. I like to get into, I of course always go, tell my clients, therapists love to ask about your childhood. I like to learn how to part of Heather's point, how did you learn what you know? Who taught you this? Where did you gain this information that sex is bad, sex is shameful, having too much weight on your body, you should be ashamed of that? Where did you pick? Who taught you that? Who modeled that for you? I'm not judging those opinions that you hold. I'm just asking where they came from. And to really dive into that is so helpful. And it also is really cool watching them talk out when they're talking out loud. Every now and then I'll catch them realizing, wow, did I just say that? Like, oh my gosh, I didn't realize that belief. So those inner dialogues, those internal belief systems that we all have, and they can be skewed. And we get to an age where, like Heather, we keep picking the wrong person, or we keep doing the same thing. And why isn't it working? And when we can break open the belief systems that our clients have, and really kind of just with complete respect to how they got to where they are, and to kind of talk about, would you entertain a new way of thinking about something? Would you entertain a new way of experiencing someone? And to kind of go there with them has been my approach historically. And I find it effective, and being able to really tune into the inner workings of one's self-talk. It's huge. Our self-talk is huge in our existence.
Absolutely. I'm curious your thoughts on eye movement desensitization and reprocessing, that EMDR.
Mm-hmm. I am not licensed in it. I think it's incredibly valid, and I've heard good results from it. I am not proficient in it to speak to its pro or con, admittedly.
Okay. Okay.
We do have Blake Overstreet here at the practice, who is EMDR certified. He's got a lot of experience working with trauma and addiction. He's a phenomenal human. He's very cerebral, very, very smart, does something called psychodynamic theory. I keep telling him could you please send me Psychodynamic Theory for Dummies book? Because I literally don't understand the words that are coming out of your mouth. And I also have a master's degree like you. How did you get so much smarter than us? But he's phenomenal. And so we do have somebody on staff that is certified in EMDR, if that's something that someone would need.
Okay. Now, let's talk a little bit about behavioral sleep interventions because I know that that's such a struggle in midlife for so many women. They're having a hard time going to sleep or staying asleep, whether it's turning off that busy brain. Now, obviously, if they're having hot flashes and night sweats, we have to address that if that's disturbing their sleep. But in some women need sleep studies because we know that there's sleep disorders, sleep apnea is more common as we go into menopause. However, sometimes it's a behavioral component where either we're on our devices until we hurry to get to bed, right? Or our mind is racing and we just can't turn it off, or we're waking up at the 3 a.m. wake up call and cannot, we woke up to pee and then can't get back to sleep. And we know our alarm's going to go off at 5 a.m. This is a universal experience. I hear it from all sides and all ages and stages. So, how do you guys help women deal with this sleep issue?
I would love to jump in and Heather's probably knows exactly where I'm going to go with this. I'm a big believer in lifestyle being an absolute caterer to our sleep. And now, hormones and all of that, that is why I send them to you, Dr. Moyers, because
Yes.
that's when I'm like, oh, that's real. What you're going through, the hot flashes and the stuff, absolutely real. Please go see our friend, Dr. Moyers, because she will give you some things to help understand what your body's going through. For my clients, I often address, it is when I ask the annoying questions of what does your sleep hygiene even look like? What is the evening routine? Do you have one? You don't? Well, great. Let's create one that suits you and your household. And do you have little kids you're trying to put to bed? Are you live by yourself? Do you live with many? Do you live with an annoying 60-year-old mother who is whatever, as Heather said? And
Oh God, no, we don't live with them.
let's discuss the sleep routine. Let's discuss how hydrated you are through your day. And let's discuss, are you moving your body? Are you exercising at all? And exercise does not mean gym rat. It just means, are you taking a walk once a day or getting your dog out to the dog park and running around? Or like, what are you doing to move your body? And how are you eating? What food do you eat? And I usually am obnoxious because when people say, oh, I eat pretty healthy. And then I say, tell me about it. Tell me what you're eating. This is not a judgment. I'm not asking to judge. I'm asking to learn. And so tell me what you're eating. What do you consider a good lunch? Like whatever. And really start talking about things on the lifestyle. How much sugar are you consuming? How much alcohol do you consume? How much are you eating enough protein? Are you eating enough fiber? Are you getting enough potassium and magnesium? All these things. So I kind of hone in on the lifestyle. I have the whole little Sheen method that I penned years ago, which is the acronym for sleep, hydrate, exercise, express, and nourish. Those 5 verbs. And it's just a little bit of a checklist for my clients to start really noticing about their day in and their day out and their lifestyle, because all of that supports or breaks apart our sleep.
100%. And this is why there's a whole lifestyle medicine specialty. And that is the crux of it. I mean, that is the crux of it. You got it.
And I think sometimes obviously subscribe to everything Beth says. That's just something kind of practice wide. We really all just do check-ins on that. But one of the things that I have found that works really well for my clients is to kind of focus in on how you start your day and how you end your day determines your entire day. And I will even, allow, because I always say clients are very much in control of their own therapy. And I will say, tell me which place seems the most realistic place to start. Like, do we think we should look at some shifts and changes in our mornings so that we're starting the day differently, healthier, in a different mindset space? Do we need to end our day differently? And so then we'll go over those and that typically what we'll see with that is it's 100% behavior. It's 100% behavioral choices. And I always say that's a good thing and a bad thing, right? It's the easiest thing to change if you decide that you're going to want to. Mm-hmm. It's the hardest thing to want to do.
Yes, I love that, Heather. I love that. That's well said. Mm-hmm. I agree with that. And I can even on the morning routine, I have encouraged my clients to not pick up their phone first thing. All of us do. If we don't, then we're tempted to. But don't pick up your phone first thing if you can. I get it. Everybody has different households and kids running in and out, or however it looks upon waking up. But if you can, wake up, or at least in the first couple hours of your day, sit still and make decisions about how you're going to think today. How you're going to think today. And because we are in charge of our thoughts, and our thoughts absolutely lead our behaviors, they lead our feelings, they lead our outlook and perspective. And so, as cheesy as that sounds, just like to Heather's point, it's not the easiest thing to do. But if you can start tuning in the first couple minutes of your day, I wake up and I have the fortune of living by myself, and I can wake up peacefully. I often wake up to a sunset right in my window. It's glorious to me. I don't take it for granted. I don't think I take it for granted any day of the week. And I wake up and I really try to decide, how will I experience today? How will I show up today? How can I adjust my thoughts? Am I feeling down? What can I lift myself in any way through my thoughts alone? And that sounds simple and easy, and but it's a powerful tool if you start to tune in early in your day, to, like Heather said, to that determines your day. It really can
Yeah.
determine your day.
That makes me think of this little life hack that I've adopted in the last couple of years. And I learned it from one of the many self-help books that I've read about reducing stress and mindfulness, etc. And it is just a thought dump at the end of the day. So journal at the bedside, and you just kind of write down all those thoughts that are racing through your head that are bothering you, or things that need to get done. And, it's just the things that you're thinking about when you're trying to be present for sex, or the things that you're thinking about when you wake up at 3 a.m. This is what we do, a thought dump, and just put it down. And then 3 things that I did well today, 3 wins for the day. And sometimes you're grasping at straws to look for a win, right? But you find something. And then for the following day, it's a win if these 3 things happen, instead of that list of 15 things that need to get done. What are the 3 most important things that I need to do? And for me, that has just reframed my brain so that I'm going to bed with peace and I'm waking up with intention.
Yeah. Yes. I love that so much. And I'm just such a believer in, and I've been educated this way, and I've reinforced it through my therapy practice. I am such a believer in the power of our thoughts, and in the power of our lens, and the way we look at, which is why I love to dive into childhood, because a lot of our thoughts were taught to us. Think about this. When you see that, this is how you're supposed to process that. This is what you're supposed to believe when you experience this. And I believe in our minds are so incredibly powerful. I mean, that's a yes, there's so much research that suggests such, but the way we think is an option. We get to choose it. We get to choose. And man, that pisses some people off, and I don't blame them. It's an annoying thing to hear when you're down in the dumps and someone's like, well, you could choose to be happy. Shut
Sure.
up. Like, no.
Sure. But I think it's also very exciting to know that we do have so much neuroplasticity. Like, we
Agreed.
can relearn things. Just like we
Yes.
can learn to be better at sex. We can learn
Yes.
to be better at retraining our brains and managing our minds.
Yes.
However, saying that, sometimes therapy is not going to be enough, right? And we talked about that multidisciplinary approach. We may be on our hormone therapy, we may be on sleep meds, we maybe have all the things covered, but we're really struggling with making it through the day with our emotions, depression, sadness, overwhelm, grief, etc. And we may need to seek therapy. So when is it that you feel like, okay, we need some medical intervention here, and you're recommending patients get evaluated?
When do we recommend medical help? When this is the simple answer. For me, it's kind of silly, but when it's clearly out of my scope, and when and I had a client not but a handful of days ago just so upset about how she was feeling hormonally and all of this, and me encouraging her, okay, I know you, and I know we're dealing with hormones. We're not dealing with thought processes. We're not dealing with hydration. We're not dealing with, and this is the beauty of continuing with your therapist, because I know her. And that's when I said, I want you to get off this phone call, and I want you to walk into Dr. Moyer's office. I want you to just walk on in, just stand in her waiting room. You'll
Yeah.
feel better there, just
That's right.
go.
That's right.
And she got a laugh out of that, because I literally said that to her. I'm like, just go and let those women love you. Like, let those women and all of their knowledge, they know so much about what you're talking about. And it's going to be such beautiful validity and answers that I simply don't have. I don't have that
Right.
knowledge. And
Right.
so that's when that's my simple answer, is when it is out of my scope and I know my client, because they've done such a good job coming in to steady therapy, then I can say, oh, I know exactly where you need to go to get the
Yeah.
help that I can't offer you.
Yeah.
Yeah. And I agree with that fully. And I think that's why, when I do a consult with a client, I say, I just need you to understand that this is about the relationship between you and I first. Like, I don't have a magic wand. Like, we have to get together, and you have to like me, and you have to trust me, and then we'll do the work. Right. And so I think that idea of having that it's all starts with the relationship with your therapist is so important, because when I develop that, then a month or so down the road, I can say to you, Beth, this is I love you. This is what's happening to you. Why are we fighting this? Can you please just agree to make this phone call? And I think even if we're, looking at it from the hormonal perspective, or even those who may get to a place where they feel like they need some medication management, some psychiatric medication management,
Sure.
knowing your client well enough to say, okay, talk to me about what part of this feels out of your control, right? We've done all the hormone therapy. We've done lots and lots of cognitive therapy and talk therapy. We have a great relationship. Something is still missing, right? And it's my job ethically and professionally to say, I need you to go to somebody else and let them ask you some questions, because I think there's still a component of this that's beyond your control. And I want my clients to feel supported in all the way around, totally holistically. So
Sure. And I think it's important too that women realize that you're not alone, that depressive symptoms and perimenopause and menopause increases drastically. Some 30 to 35% of women are experiencing this in this phase of life. So you are not alone, and there are resources available to you. And I'm so happy for my listeners to get a flavor of Vervewell before they even step in the office. I think that's one of the magical things about podcasting, is that you develop that like no trust factor before you
Absolutely.
ever step in the door.
Dr. Moyers, to vamp on one little thing you said, is our client's not alone. I wrote a book 2 years ago, and it's a decent disclosure of my own personal story. And I did that with a heart of, I want you to know that you're not alone. Like that. Here's my story. There's some crazy in here. There's some wackadoo things that I've done, some really bad choices, or some situations where I was 100% a victim, and being able to say, this is me, and to be able to share that, because I'm such a believer that if we all really walk around a little bit more transparently, not all the way, but just a little more, we would really help the psyche of our culture. I really believe that, because if we learned that other people had hard times and not just smiles and everything looks so good, and social media has a way of really allowing us to believe
It's not all Instagram perfect.
that's right. That's right. So I think that sharing stories and being able to, and I'll tell clients every now and then, I'm like, let's swap some stories, because you are so not alone in what you're talking about right now. And I'm
Mhm.
here to listen, and I got you,
Yeah,
because we all have this human condition, if you will.
absolutely. I love that approach. Well, I hope that everyone understands that perimenopause, menopause, this transition in life really changes more than your cycles. It can change your mood. And myself and the team at Vervewell love to unpack the biology, the life stressors, and the evidence based therapy and medical options for those depressive symptoms in midlife. And know that you are not alone. We are here for you and willing to help you in any way. And Beth, please tell us what's the name of your book so we can include that in the
Thank
show
you. The
notes.
book is titled Stop Talking About Your Childhood. It's a cheeky, kind of ironic title because it's exactly what the book does is talks about
Mhm.
childhood. So, and I love talking about childhood, but the book is titled Stop Talking About Your Childhood. It is available on Amazon. It's available in our offices. Thank you for that.
Yeah, absolutely. Well, thank you so much for being here, ladies. It's the best. I appreciate you so much. Until next week, be well.